the next question maybe gives us an opportunity to elaborate on some of the things that are going on in Idaho. The Affordable Care Act requires everyone to have health insurance. How is the state legislature going to help people who can't afford insurance? And maybe this time I'll start with Representative.
The affording insurance is, well, hey, as we saw in the video, it's the Affordable Care Act. And the goal of the federal program was to make it affordable for people. And I really encourage everybody, especially you college kids, to go online and look at what you'd be paying. I've seen the numbers. I've seen as low as $50 a month for health insurance. And I don't know how that compares to student health insurance. I think it's cheaper than the student health plan. So, and I don't know if the benefits are similar, but to me, the whole goal of the exchange is to drive consumers, the marketplace. We want people to be good consumers, to look at what they're buying, to make some choices. That drives costs down. When people have to, the pressure of the marketplace will drive these costs down. Right now, before the Affordable Care Act, individual and small group policies is comparing apples and oranges, and shopping is difficult. The goal of the exchanges was to make shopping fluid, more comfortable, so that the market forces could drive those costs down in those premiums. Now, right now, again, Idaho, with no change in Medicaid eligibility, people in the pink lines, above 100% of the federal poverty level, are going to be given support to buy insurance. There's a federal law that is required that they buy insurance, and they're going to get support for that. Below that level, what Idaho is committed to right now is paying for their catastrophic care. You get injured, you get hit by a bus in front of the Capitol, you don't have insurance, you go to the hospital, the care is provided. You will get care. A hospital cannot turn you away. You will get care, the bill will be racked up, and it will be sent to the county commissioners. And if it's above $11,000, it will be sent on to the state of Idaho. That is how Idaho has chosen currently to support indigent health care.
Just a little different track on the same question. One of my concerns has been how, if we didn't expand Medicaid, how did we cover the people that are in the gap, that don't, that really are the working poor but still do not qualify for any kind of subsidies. And to that end, I've had many discussions with the people in my caucus, and we are working on a piece of legislation, not I personally, but I'm giving input on it, but that will hopefully cover the people in the gap. Haven't seen it yet, and that's the funny thing about Boise. If you're not the writer of it, you don't get to see it till the end. Or you don't get to say too much about it or you get in trouble. But nonetheless, I've been very clear that I thought that we had to have something that would cover folks in the gap, because they certainly, whether they ask for this or not, they are required to have health insurance, and if they can't afford it, we have to figure out a way that we can make it more affordable for them. And just a comment on the CAP fund, just a little expansion on that. I don't believe the CAP fund will ever go away. I know there are people who would like it to, but I think it's a fallacy to consider that everybody is going to have health care. That isn't going to happen. There are people who absolutely just won't sign up. There are people who just are so out of the loop that they don't even know they're supposed to have it. And until they show up on the doorstep of hospital, they're not going to know any different. Then there's those with disabilities and people with mental issues. They're just not going to have it. And so I think it would be a disservice to the people of the state of Idaho to get rid of the CAP fund in entirety. Maybe we can reduce it and better manage it, but I don't think it's going away.